From the government expenditure in Oman, the health sector so far has not reached 5%. What we are aiming for, international average, is 11%. Oman was voted or nominated by the WHO at the year 2000, Oman healthcare system, as the most efficient healthcare system when it comes to finance, and the 8th worldwide in many other aspects. That's very good news for my predecessor. He did an excellent job, but a huge burden on me. Because when I asked the government for more money now, they said, oh, you don't need it. You were number one, 2000, was spending less than what you are spending now. That's not the case. So human resources, finance, and the other thing, the social, demographic, and epidemiological changes in Oman. In the 70s, most of our patients used to die from infectious diseases. Luckily, we've passed that. The vaccination rate in Oman for all the diseases that vaccines are available for exceeded 99%. If the child is not brought to the clinic goes to the child. So we made sure that all of our kids are vaccinated, so the diseases that can be prevented by vaccine are prevented. Malaria, I've mentioned to you, this child, who I might come back to him later on, had malaria twice. We used to have an average of 36 to 38,000 cases a year. That's when I was a student. I did a small study. Now we had not more than 15 cases a year, and 98% of them are imported cases of malaria. Tuberculosis, instead of every 8th person was exposed to it, now in the whole country we don't have more than 3 cases a year. So we still have the double burden of disease. We still have some infectious diseases, but the huge burden now is the non-communicable diseases. The GCC countries, unfortunately for us, are the first in the world for diabetes. Oman is number 10. The 15% of our public are diabetic. And at least 30 to 35% are pre-diabetic, i.e., unless they change their lifestyle, will become diabetic. 42% of the Omanis over the age of 40 have hypertension, high blood pressure. 40% have high cholesterol, high lipid. Obesity rate is not high as yet, but unfortunately we are heading that way. You see all these horrible fast food places everywhere, and they deliver 24/7, and they are much cheaper than where they were originated, which is not very good for us. So the burden of non-communicable diseases with some persistent infectious communicable diseases are also very, very expensive to treat. Unfortunately, non-communicable diseases, for you, those of you who are doctors, you know, the treatment is from the diagnosis till the day of death. Infectious diseases, the majority of them, they either kill you, and for the health system, that's unfortunately the cheapest part of the equation, or you'll be cured, which is better. Very few of them are chronic. So the burden of the social the pattern of disease, the other burden, our population is aging. And we don't as yet have a single geriatrician in the country. That's doctors are specialized to look after people who are aging. So I'll make sure before I age and after I pass my 21st birthday to make sure that somebody is trained to look after our elderlies. The workforce, as I said, 70% of the doctors are from outside, but also, thanks to my predecessors, they've built healthcare institutions in the country, and they trained nurses and allied healthcare professionals. And after Bahrain, in the GCC, we are the highest country in nationalization of these professions. In some hospitals, 90% of our nurses are Omanis. Overall, Omanization in allied healthcare professionals rank between 65 to 85. We are very proud of that. We do, though, still need to send them abroad for further studies. And one of the places I'll visit in my trip here is the University of Villanova. They've been very great. They've been training our nurses in master and PhD degree since 1995. So the training for nurses, training for doctors, training for allied healthcare professionals is huge. Our pharmaceutical industry, and I'm glad there are people here from that industry, are still very limited. We still import more than 93% for drugs, consumable, and equipments. The chances for pharmaceutical industries to have branches there is tremendous. Oman, as mentioned by everybody here, it's a tucked-in sort of small haven, I would like to say, because not only because my country, those of you who've seen it, it's very peaceful. I hope you've seen some of the sceneries, very beautiful. I was told the Omanis in general are nice. I'll leave it up to you to judge. Doing business in Oman should be very easy as well in healthcare. I'll guarantee you a plot of land to build a branch of your pharmaceutical industry with very little, if not free, very little price, if not free. All the regulation for the industry is in our hand, the Ministry of Health. Any drugs that are made or consumables made in Oman are automatically registered in the GCC, which is about probably 45 million population. We have the Islamic Republic of Iran, 80 million population, open to the West now. So that's a huge market. We have East Africa with very good connectivity as well, and we have the Indian subcontinent. So it should be a hub. We have the new financial district called Dukham. I'm sure Her Excellency Hunaina and the rest of the team looking after that, they've been to here. There are lots of opportunities. So opportunities for pharmaceutical industry, opportunities for training for doctors, exchange of expertise between our countries, and Pittsburgh, I'm sure with the enthusiasm and motivation of Simon and the team. I sent already actually a team to visit the hospital here. I'm hoping to see it tomorrow, and I'm hoping to have further link with the healthcare system in Pittsburgh, in particular in America in general, to enhance and strengthen our cooperation. So go back to that boy who was born 14 hours earlier than his twin brother, no schools in the country. His father had to take him 3 days trip on donkeys and camels. And don't be scared, they're very peaceful creatures, very nice, particularly camels, until he reached the destination where he went to school. And after his schooling in the United Arab Emirates, he decided to do medicine, which was very silly things to do. So he was sent to a place in the United States, I don't know if you've heard of it, called Kansas City, Missouri. And Kansas City, Missouri was very cold when he arrived. The first time he saw the snow, the airport was closed actually. And then 4 years later, after he finished his first degree in Missouri, he went to another place which he's never heard of before called Kansas City, called Glasgow in United Kingdom, Scotland. He did his first medical degree there, went back to Oman, started his rheumatology service, and unfortunately for him and some other people, he's the Minister of Health now. So he survived all that. He survived all that, and he's here with you today. So thank you very much for listening, and I'll be delighted to take any questions. Thank you.
Your Excellency. I'm going to bring Dr. Chris Martin up, and if you could have a seat to have a one-on-one conversation with Dr. Chris Martin, who has had quite a lot to do with Oman, and will be asking you some questions, and there may be a few minutes anyway for some questions from the audience. So Chris, welcome. He came from West Virginia University and has an extensive background in medicine and many pharmacology and many things. So please have a seat.
Okay.
And I hope you're...
I should be, yes?
Okay.
I think we should have brought our sunglasses.
We should have, yes. First of all, Simon, thank you very much for you and your team. I'm a public health physician, which is probably the most obscure branch of medicine. My teenage children are not particularly cognizant of what I do, but I can tell you that this all-star program, which features me, my status among my children has just risen meteorically. I want to just say a few comments. First of all, it's a great pleasure to be part of this group, and I particularly welcomed your comments, Your Excellency. As a public health physician, you might have been struck by some seemingly paradoxical data. How could Oman achieve what it did? And as a regular visitor to this wonderful country, I can state that the progress since 1970 is nothing short of miraculous in terms of the development of the country in all spheres. How can so little be spent on healthcare and achieve such good health outcomes? As a public health physician, I would argue that many of the measures put in place were public health measures. I particularly welcomed your comment about horrible fast food chains, because my Omani friends know that when we're in Muscat, the way to get me agitated and apoplectic with anger is to drive me next to the McDonald's. And when I go...
I don't want to mention names.
Oh, excuse me, I shouldn't have
didn't
mentioned names. Another fast food chain, a generic. That's not the only one. So as we interact with these regions, this is just a plea to not lose sight of the tremendous importance of public health measures. Oman's success is largely due to the wisdom of basic vaccination programs, improving overall housing and quality of life. And the data is clear. That's how you improve the health of a population. Healthcare is important. It plays a relatively small role, however, in why people are healthy. And please don't repeat our mistakes, and that's the discouraging fact about obesity rates and type 2 diabetes rates. It's a very exciting time to be involved in healthcare education. There's really two aspects of our partnership with these countries. One is bringing people over to our university. So we have a lot of activities with a number of countries where we bring physicians to come and train at our institution. Why do we do this? I come from one of the poorest states in the United States. We welcome the fact that we can have residents serve in our hospital. We need that excess capacity. It also helps our diversity efforts. And one of the wonderful things about the work of this institute and our partnership with Oman is increasing the understanding. As our dear colleague from Egypt mentioned, when we get people back and forth to actually visit these countries, every year I bring over medical students to Oman, and to see how they embrace the culture, how misconceptions are dispelled, and how this improves the understanding. There's much more than just specific healthcare knowledge. So, Your Excellency, where do you see Oman going in the future? You mentioned some of the goals in terms of nationalization of the workforce. Where do you see the Sultanate in, say, 10, 15 years?
Thank you. There's a point which Chris mentioned. The strength, actually, of our healthcare system is primary healthcare, which I'm very proud of. I'm a hospital clinician, and when I was appointed as the Minister of Health, my colleagues in the primary healthcare were so scared. They said, oh, he'll forget about the primary healthcare, he'll move to hospitals. I didn't. Well, I did, but in a way, we consolidated the achievement in primary healthcare, but also with the aging population, with the changing pattern of diseases, we have to also improve our tertiary care system. So our plan now, in the pipeline, we have 10 hospitals. Most of them in the final stages of design. They are needed, even though the economic situation in the region is not very, at the moment, encouraging, but they are needed, and that will complete the infrastructure completely. In 10 years' time, you asked me where we see ourselves. In 2012, I think we are the first country in the Middle East and North Africa where we've had a healthcare plan called Health Vision 2050, which is in our website. We spent 1.5 years identifying, diagnosing the current healthcare system in Oman and status. That was done by local expertise and help from friends from abroad. After that, we had several workshops regarding this Health Vision 2050. Then we invited experts from at least 12 countries. There are 5 from the United States, from Britain, from other countries, and we put what we call a roadmap for the healthcare in Oman between 1910 or 1912 to 1950. Of course, we invited Parliament, members of the Parliament, to attend the final session, and the only thing they thought of, this minister is very clever, not. He wants to stay as a minister till 2050. That's why he's putting a plan till 2050. But I'm hoping that in 10 years from now, we would have completed the infrastructure for 50 years. We would have had more Omanis with medical degrees and allied healthcare professionals from different countries. Her Excellency, the Minister of Higher Education, Dr. Rawi, which you've met, we've agreed with her the year before last to send some Omanis abroad because the capacity for the medical schools in Oman, we are very grateful. The Oman Medical College, which is the only private medical school producing about 100 now or 90 plus
Over 100 now.
Over 100, and the Sultan Qaboos University 125. So 230 graduates a year will take us 100 years to reach 50% immunization. So our first priority now at the Ministry of Health is building capacity, human resources, consolidating on what's been achieved, mentioned from our healthcare indicator, and improving the care for those with chronic diseases. And unfortunately, our preventive measures are still not as good as they should be. Changing the culture of people, eating habits, lack of exercise is not very easy. Luckily, so far, smoking is not a major issue, and I hope it will never be. So we'll complete within the coming 10 years, hopefully somebody else will take over and continue, complete the infrastructure and strengthen the human resources. Finance, we are aiming by 2030 to reach 5% GDP expenditure. And I think we are heading there because 3 years ago, with directive from His Majesty, we improved the pay for healthcare professionals significantly so that we could attract good quality doctors from all over the world. We are unfortunately under-advertised. I mean, Oman, many people don't know even where we are, which is not a bad thing sometimes, but it's a beautiful country and very peaceful and easy to work with. Our working hours are also very attractive because they are not as long as in many other countries. I'm changing that, though, unfortunately, for some of my colleagues. So that's where I think we should be in 10 years' time.
Yes. It's interesting you mentioned the human resources element, which is, of course, my major interest. A very interesting trend is occurring in health education, which is driven by global accreditation. And for you business people in the audience, when you stay in a hotel in Dubai, implicitly you assume that it's been built to international standards, which would be the same regardless of whether this is Dubai, Singapore, or Pittsburgh. The House of Medicine, which is perhaps one of the more conservative parts of society, is now essentially undergoing this kind of transformation. So, for example, His Excellency mentioned sending Omanis to the United States for graduate medical education. This pathway will no longer be available to any international medical graduate come 2023 if they do not graduate from a globally recognized medical school. So this is a huge trend that's truly transforming. When I travel to the region, it's interesting because many countries are there. I am myself a Canadian-trained physician, so my mother gets very upset when I say this, that I think for a variety of reasons, the US model is the one that I see predominating in the future because of a unique set of advantages that the US system has. So I think this is a very important trend because what it is imposing is a very significant burden on medical schools throughout the Middle East to essentially comply with the same level of accreditation requirements as exist in US medical schools. The same trend is occurring in pharmacy schools and other health profession sectors. But if you think that this is an easy feat, there are many medical schools, very well-known medical schools in North America that are currently on probation status. And again, I won't name names again because I've already made that mistake. But this is a great task and another area that we're working on collaboratively with Oman Medical College. And I would also say an interesting statistic from our collaboration is that 85% of our students at Oman Medical College are women. So we have the problem of how do we get affirmative action to get more men in our training programs.
You have 85% of your students women. I have 85% of my workforce women, which is interesting. And